any pain at all?
No.
Very good. Your neck and jawline look amazing. You can already see some of the improvement here. And look around the smile lines here. See how smooth that is. Now take a look at her before pictures. You'll see how much improvement we've been able to give her. So it's a really nice improvement, and you see we're really excited to help her look her best. How many? 63 years young?
Yeah.
63 years young. Why don't you come around on this side and you can look from over here. So this is the hair sparing. I'll have you come right over on this side. A hair sparing incision. So I'm going to come right across through this way, which is very difficult to see. So I'm just going to remove this part here, but we're not removing the hair follicles, so the hair comes right back. And so now, right across in this area. Perfect. Very good. You're forward. Release for me, please. So this is not a traditional facelift. This is local anesthesia facelift. We call it our mid-lift of the image lift procedure.
Lucy said it looks painful.
Are you having any pain, Tammy?
No, none at all.
Tammy says no pain at all, and that's what our patients tell us based on our numbing techniques and the way the procedure is designed. You know, a lot of doctors, they won't offer facelifts under local anesthesia, and I can understand why. It is a skill set, and they prefer general anesthesia where the patient is totally out, but most patients don't want to be put out. You actually get to know your patient better when you're able to talk to them, and you can accommodate them better because if they want to move their legs, they move their legs. If they need a little cushion in their behind their back, that's easy to do. So all of these things are something that you get comfortable with once you do this on a regular basis. So doing it under local anesthesia is a skill set. You want a doctor that does a lot of local anesthesia. If they don't do a lot of local anesthesia, it's harder for them to give the patient as good an experience. That's why patients come to me. I've done over 4,000. We do our seminars. We talk about it in our Wall Street Journal best-selling book. And you see it here on our videos as well. So these are the Cons facelift scissors, just elevating subcutaneously. You can see the level of the plane that I'm in right here. You stay superficial. You stay above the SMAS, which stands for subcutaneous musculoaponeurotic system. And then I'm just elevating here. You're also cautious for the great auricular nerve, which comes out around the sternocleidomastoid. Perfect. Right now, mouth breath, please. So I'm just going to do a tiny bit of cautery here. Everything's looking good. We monitor blood pressure, we monitor pulse ox, we monitor heart rate, but most importantly, we monitor the patient. So if I say, Tammy, how are you feeling? How are you feeling, Tammy?
Good.
If Tammy tells me she's feeling good, I know she's doing good. That says a lot. That says better than most monitors will tell us.
Lucy asked how much this procedure is.
People want to know how much the procedure is. You know, it's difficult to give you a price if you don't have a plan that is right for you. This procedure is not for everyone. Some will do less and some will do more. So we don't want to mislead people and just say, well, it costs this much, because you may end up choosing more. You may end up choosing less. You can go to imagelift.com/pricing. You can do that right now and get an estimate on a price based on what you're looking for. Or call us and we'll put a plan together for you, and then my team can, of course, every plan we give, we always have a price that goes along with it. Thank you for watching. Thank you for sharing. We're on a mission to stop bad plastic surgery. Release, please. Yeah. And now I'm going to use the 2O Merceline, grabbing the SMAS layer. This is a modified SMAS plication. Perfect. Very good. Flash the knot, cinch it down. This is not a skin-only facelift. This is not a thread lift. Perfect. There's physical versus social downtime after the lift. Physically, we get back into our routine. That's fine. Errands, shopping, things around the house within a day or two. Socially, we pass the grocery store test, 7 to 10 days. You walk into the grocery, nobody does a double take. We are proud to be leaders in posting live video of patient treatment. A lot of doctors do pre-recorded. They won't do it live, and I understand that. But we want no filters, no editing. It's all here.
Lucy asked, what if you had a liver transplant a year ago and your diabetes, all you need is bags under my eyes?
Yes, I can help you. Non-surgically, we can do fillers. There are treatments, and I do have transplant patients that have come to see me. So the answer is we can help you. Give us a call, 813-463-9245, and we're happy to put a plan together. And if you need to get a clearance from your doctor, we can do that. But come get a plan first, so that way you'll know your options. But the answer is, I can still help you. That's 100% for sure I can do that. Very good. So now that I've done the tightening, I'm going to do a little extra undermining. For the physicians and students that are watching, this just allows that the skin lays down a little bit better. You see how nice that looks? And there's a little extra. We trim away the extra, measure twice, cut once. Perfect. I'm going to free up the earlobe here. Good.
Lucy said thank you.
You're welcome. Please do share. Keep your family and friends safe. Let them know how to do things the right way. Remember, most injectors that are out there, if you go somewhere and you get a filler or you get a treatment, the odds are, just playing the percentages, that your injector is a beginner. Because there's a lot of injectors out there. Don't start with the beginners. I mean, that's just not the place. Your face is worth too much. Perfect. Behind the ear, please. Tammy, how you feeling, dear? Everything's looking good. Behind the ear, please. Okay, perfect. To a vicryl. So now we bring the skin edges very close together for the smallest visible incision. So Tammy, here's your homework for tonight. Number one, you want to keep your head elevated. I want to see this top part. You want to keep your head elevated. Number two, you want to drink enough fluid that you have to go to the restroom every couple of hours. Number three, every couple of hours you need to check to see if you need a pain pill. If you sleep for 6 or 8 hours in a row, you don't want to get behind. Not the end of the world to get behind in the pain medicine, but we prefer to avoid that. And then I'll call you later. You call me if you need anything. I give my cell phone number out to all my patients, and we'll do the wound care, all the wound care tomorrow. And I'm going to show you how to do the wrap on the video. And tomorrow we'll show you everything. I'm showing the viewers, the doctors and physicians and students and patients watching. Very good. See how those skin edges come together really nicely. We preserve the integrity of the tragus. I can even reconstruct the tragus. If a patient has had a lift before and their tragus looks flat, I can create a new one for them.
What is a tragus?
Tragus is that little bump of skin right in front of the ear. That's the Latin word root for goat, like a billy goat's chin. And I like what I see in the lobule area. So, 5-O-chromic, we take the stitches out. Usually I let them fall out on their own. And usually they'll fall out within 1 to 3 weeks. Perfect. I'm going to retie this knot.
Erlinda asked which medical. She said, I'm sure medical insurance will not cover this due to considered cosmetics.
The only insurance we accept is a Visa, MasterCard, and American Express. So yes, insurance does not cover this. We accept care credit. Patients will do this because they want to invest in themselves. They've raised their family. They want to do. It's time for them now, or they're getting over a medical condition, or they're getting into a relationship or out of a relationship, or they've got a reunion, or a child is getting married, or all the reasons people will choose to do a cosmetic treatment. The most important reason to do a cosmetic treatment is for yourself, right? It's something that you want, you've been thinking about, and you're doing it to make you feel good, not anybody else. Tammy, what did your husband say when you told him you wanted to do this?
He said I didn't really need it.
He says she didn't need it. By the way, that's the right answer. That's always the right answer. You don't need it. I love you just the way you are. But he's supportive.
Yes.
Well, that's nice. Married for 43 years? That's awesome. Good for you.
Thank you.
Now, is he going to get upset if we make you look younger than he does?
Oh, no.
No, he's good with that. He's like, I'm fine with that. It's okay by me. Perfect. Taking some of the spin out of the thread. Very good. I tell patients to be careful when they're putting shirts off and on, because you don't want it to catch on the earlobe. It's not the end of the world if the earlobe gets pulled. But you prefer to avoid it. And usually they do just fine. I must have thrown at least 1 million stitches in my career. My grandmother was a seamstress. My socks would disappear when they had holes in them, and then they would magically show up and she stitched them together. My patients ask me, they're like, do you stitch your clothes? I'm like, no way. I'm too expensive. When I'm home, I'm going to hang out with my kids and play tennis and hang out and goof off, but I'm not stitching clothes when I get home. But I'm grateful my grandmother did it for me. My dad used to go fishing, and he would have his casting nets, and he would sew and make the casting nets too. Let me turn your head all the way to the middle, chin all the way up for me, and now I'm just going to take a look. Okay, good. So it looks just the way we want it to. I add a little bit of gauze through here just to check things out. And I'm making sure there's no excess fluid or that we take care of all of that. The wrap, people ask, should they ice afterwards? The wrap really does a better job of holding pressure. Chin all the way up for me. But you can certainly ice in front and behind the wrap. You won't feel it because the skin is numb. Do you feel a little bit of a pinch here? You have to stay exactly as you are.
Mm-hmm.
Not too bad?
Yep.
Okay, release for me, please. Now look at this neck and jawline, and now I want you to go and look at her pictures, and look at the smile lines through here. And now go take a look at her pictures, and you'll see what a difference. Very proud of Tammy. Please don't put that away. Yeah, keep that nearby just in case. Turn your chin this way. I'm gonna... Can you start with the Hibiclens? While I'm stitching, I'll have Ari do some of the Hibiclens. I prefer Hibiclens and not peroxide. You can use peroxide, but peroxide is also abrasive to the wound. So you don't want to use, you want to use very little or none at all of the peroxide. So Ari is going to cleanse with the Hibiclens, then put a lot of Vaseline. And I'm going to put this last little stitch here. Tammy, do you feel a little pinch there or not really? Everything's looking good. Moist wounds heal the best. So lots of Vaseline, lots of petrolatum. You can use antibiotic ointments, that's fine. But the moisture is what heals the best because it gives you a foundation, a matrix for the epithelialization to happen, and it also reduces the scabbing and crusting. The scabs and crust will just fall away, but if you don't have moisture and it gets dried up, that's a scab. The scab can actually impede the healing a little bit. It's kind of like a biologic dressing. If you keep it moist all the time, that's where you're going to get your best outcome with any wound care. Okay, so we are completely done, and you did great. Hopefully that wasn't too bad.
Not bad at all.
And I'm going to take your little eyelid shields out. So now we're going to put the wrap on. So when we do the wrap, the purpose of the wrap is that let me show this to you. The purpose of the wrap is to hold pressure. So can you see here? You see your neck and jawline? How does it look so far?
Good.
Amazing. Now you're still swollen. You don't want to taste the chocolate cake before it's done baking, but it helps in these areas. You got a little plumping in the lips, so congratulations.
Thank you.
Now once we put the Vaseline everywhere, and I put it across the skin because it prevents chafing with the wrap, if the wrap irritates, I tell patients to just take it off. after the second or third day if it's irritating you. But for the first 24 hours, leave this on, and then I will do the wound care and change the dressing. This is a Curlex, and this is a gradual, an incremental pressure dressing. Ari's going to put her hands underneath Tammy's head. Just let your head rest all the way back into her hands. So at this point, we want the patient to rest her head back, because if she's lifting her head up, we don't want her to bear down and increase pressure or increase potential for bleeding or anything like that. Pulse ox is great, heart rate is great, everything's looking good. I use a specific procedure when I wrap. I'm in the front, and then I'm trying to hammock in these areas, because this is where I want to keep pressure pushing in through here. So I'm in the back, now I'm in the front, just pushing in those areas. Very little pressure for these first few wraps, and then after that, I'll put the elastic ACE wrap. If a patient tells me if they feel the wrap's a little too snug, the first thing is we want to make sure the pain is under control. So I ask the pain, with the pain score 0 to 10. We like to see patients in the 2, 3, or lower range. And if you stay on top of the pain medicine, some patients say they have no pain, or 1 or 2 or 3. But if it's higher than that, that means we need more pain medicine. And I make a little twist under the chin so that it does not push on the windpipe. So twist under the chin, posterior part of the wrap, now anterior, that means in front, anterior, and then posterior, which means in the back. Another twist and one more for good measure. Everything's looking good, Tammy. Congratulations. I'm so proud of Tammy. She was such a great patient. We did not have to give her any warnings or anything like that. I'm just kidding. We don't give warnings. And we don't need to. Our patients do very well. So, how does the wrap feel? Good. All right, everybody. Congratulations, Tammy. Thank you for watching. I'm Dr. Rich Castellano. Let's take a look this way one more time. We're on a mission to stop bad plastic surgery, softening around the smile line, tightening around the neck, 63 years young, and we're improving on where we are. You got to look natural. We got to keep you safe. All right, we'll see you in the next video. We'll see you later.